Welcome back to another episode of What's New in Data. I'm your host, John Couttet. Today I'm joined by Jonathan Shough, CIO of Parexel. Parexel plays a critical role in the health economy, helping biopharma companies run the clinical trials that bring new treatments to market. Their work impacts how quickly and safely life-saving therapies reach patients around the world. As CIO, Jonathan is focused on making those operations more efficient and reliable through better use of data and AI. Let's jump right in. Jonathan, how are you doing today?
I'm doing great, John. Thanks for having us today.
Absolutely. We've been talking about doing this episode for a few months now, and I'm glad we finally have the opportunity to do it. You're doing a lot of innovative work, and for a company that's providing just a critical service to all of us, here in the U.S. and across the globe. So really excited to get into this. Jonathan, I want to just ask you to tell the listeners about yourself.
Sure. So again, Jonathan Shough. I actually am in North Carolina. I have 4 children and a beautiful wife who keep me on the straight and narrow. And those 4 kids ensure that I think I'll be working till I'm 80. I've been in the life sciences industry now for 26 years. And so delivering much needed drugs and therapeutics to patients is something that has become very, very near and dear to my heart. We like to say in this business, if you're not a patient, you certainly know a patient. And if you're not a patient today, you probably will be a patient. And so to your earlier comment, the work that we do really is incredibly rewarding, but it's also instrumental in improving lives for patients. And we really enjoy the work that we do.
Yeah, and there's a lot of great topics that we'll cover today about how you're innovating, and I wanted to understand how has the role of CIO evolved at Parexel as data has become more central to both operations and this innovation?
That's a good question. First and foremost, I think it's evolved quite significantly just in this industry, not just within Parexel, but the role of CIO really has become more focused on looking at, one, how do we drive operations, but also how do we drive innovation? And, I'm a big proponent that the business really drives our innovation. The business is really where we learn more about how can we drive more innovation, drive more efficiency, give people more time back in their day to do the scientific and operational work that drives products forward. And everything we do really points to how can we improve the value of time, price, and quality for our patients and for our customers. And so I think it's moved from that traditional infrastructure support. Do I have a workstation? Do I have software? Into almost being a cheerleader and really focusing again on that operational and innovation that is going to drive our business units to really perform better in delivering for our patients and our sponsors. I think a lot more focused on strategic leadership around digital transformation. So how do we move from how we've done things over the last 10 years, 20 years, 30 years to more modernized approaches? How do we drive more data-driven outcomes? Because we can now visualize, we can access and tap into data now more than we've ever been able to do. And I think also, the advent of that human interactive AI that you and I've talked about, where we now can really harness and build on what AI can offer to the everyday user. It's not just a technology tool anymore. It's actually now able to be interacted with by a member of staff, an executive admin, a data manager, a project manager can all interact with AI. And so we're starting to see that ecosystem evolve and develop. And also I see, driving more standardized approaches, fostering that innovation, as I mentioned, and delivering measurable impact. And I think the last thing that has happened is, as a CIO, we're now even more focused on how do we develop our talent? How do we make sure that we're building the talent that's going to move us into the next generation of delivering pharmaceutical products for patients and our customers. And that's a big transition for us, because again, it's no longer about the back office. It's also about interacting with the business and really driving innovative and creative approaches to improve operations.
Yeah, 100%. And, as CIO, you're building that central brain of the organization, which is really where, the company gets that, compounding gains, like learning from what you've done in the past, making better decisions in the future. And, traditionally these data platforms that CIOs use, there's a layer of complexity, right? With SQL and being a data analyst and things like that. And we were chatting offline, and like you said, this kind of human interactivity on the business side that's being enabled by AI. I'd love to hear more about that.
Oh, absolutely. I mean, I would point to the fact that now that we through some of the interactive AI capabilities, we're now taking sparks, if you will, and we're turning those into really quick, small campfires that allow us with the business to quickly ascertain if I just, incrementally thought differently about my process. So for example, at Parexel, we have a process that we call the Parexel Precision Pathway. And the idea is, what's the shortest distance between the point of starting a project or a study, as we call it, and finishing, and everything we can do to compress time, to increase quality, and also positively impact price. We want to do those incremental activities, and traditionally it's been very difficult because you're in a pseudo monolithic environment between the regulatory environment and process and the compliance that's required, that just the inertia of complying and ensuring that you're doing things with the rigor that's required. It was hard to move things forward. Now with AI, we can simulate in ways that we've never been able to simulate before. And not only simulate, we can now take that simulation and quickly turn it into active capabilities that the business can leverage to do that thing that was a spark, just a few months ago. And so we're really seeing, particularly in our Office of AI, which we established recently under the leadership of our CEO, Peyton, and we actually are seeing that acceleration and that ability to take ideas and compress the time that it takes to go from idea in the business to actually looking at real solutions. I'll give you an example. Our Parexel AI assistant, we launched in August 2023. We now have 18,000 subscribers out of our, call it 22,000 employees. We average about 6,500 discrete uses per week. We have over 100 stored queries in our prompt library. We have a center of excellence built around that allows those prompts to be reviewed and published in the library so that people can utilize them. And just in software costs alone or licensing, we're easily seeing a $5 to $6 million save on that front. On the production front and driving more productivity, we haven't, to be fair, we haven't perfectly articulated what we think they are, but we know they're significant. And just the fact that we've seen over 3.5 million prompts go through that system in less than 2 years is astounding.
Yeah, and what you're describing is operating in not only enormous scale, but like you said, you're in a regulated industry, and rightly so. And there's different ways of working with data when you're in a highly regulated industry. So I'd love to learn from you. What's the path to truly like unlocking value from data without compromising on compliance?
Yes, and it's a great question, particularly in that sort of accelerated example that I was referring to, because there's still danger and concern, right, about making the wrong decision. There's concern about, are we excluding potential patients that should be included, et cetera. And so I'll call it the bad news to the good news. And I say that a little bit tongue in cheek, but you still have to drive in order to really unlock the value of your data, which, is what AI is all about. You still have to drive compliance, and you still have to drive the regulatory requirements that are key to making sure that, like in our case, we call it transparent AI, that we're driving a transparent AI process. But I would actually offer that part of what we've changed in that discussion is really looking at compliance as an enabler. So instead of thinking about it as a fence to get through, we actually see it more as a training wheel on a bicycle, right? That it gives me the ability to stay upright and to make sure that I'm staying on the pathway. And while I'm doing that, I'm learning a lot about the data that I'm utilizing, the patients that we're identifying, the therapeutic areas that we're learning more and more about, the process that we're enhancing. But the point is, and why I mentioned the bad, sort of the bad, is you still have to drive governance. You still have to have, in fact, I would argue, an even more compliant and defined data architecture. You still have to look at how do you monitor and manage the automation that you're driving into the system, because as one of a partner friend of mine that actually we work with at SAS likes to say, the garbage in is at scale out when you use AI. And so those things continue to be important. So you really can't shortcut them. But because we're using the approach that we're using with again, compliance as an enabler and ensuring a tight data governance and defining, is it allows us to maintain that alignment. Two, it makes sure that when people are utilizing a tool, whatever that tool might be, that they can trust in the data. And that's critically important to us. And then as our ecosystem grows, we are building in that continuous adaptation to make sure that investment and our compliance native tools continue to remain viable. And we can sort of pre-plan, pre-populate what is it we need to do to sustain competitive advantage.
Yeah, and I love how you phrased it as compliance. Was it as an enabler?
As an enabler.
Yeah, and that's so important. I think this applies to lots of industries where, you're really raising the bar of your operations when you say, compliance isn't just something that's slowing us down, but it's also enabling us to maintain more rigor around our processes and do things the right way. And ultimately you're delivering, better products to, your customers. And I think all companies, and even if you're not in a highly regulated industry, should figure out, like, what's that thing that should slow you down, right? That ultimately delivers a better product that was built the right way with the right amount of rigor and right amount of planning and thought and care to the ultimate end customer and the internal operations. So I like the way you phrase that. And of course, with AI, I mean, one of the things that you mentioned this a little bit was having the test data sets and being able to generate synthetic data at a rate that's never been done before, and have that synthetic data really be a good mimic for your internal tests, right? And then that kind of helps you sort out some corner cases. Then finally, once you bring in the real production data.
John, that's a great point, and a little pat on the back around Striim, Databricks, Kafka, some of our other partners that we're working with. And I would even point in this case to Striim, our ability now to get at data more quickly, and now that we have in place data cleaning, data quality review, data defining, and those aren't in the right order necessarily. But the point is, because we now have automated those capabilities as we pull data into our lakehouse, leveraging Striim actually gives us the ability at scale, at volume, and enterprise grade way to actually see what's happening with results, what's happening with a site, what's happening with a patient, far more near real time or real time than ever. Now, to be fair, real time in our world is an interesting concept because I'll give you an example. When a patient goes to Striim, or maybe a better example is when a patient shows up for a visit, and let's say they have to have a lab drawn and have blood work done. Real time in that context is probably 3 to 4 days, right? So when we say near real time or real time, I like to say when necessary. When we need access to that data, Striim and our architectural approach allow us to get that data as soon as it's available. It's gone through the process of ensuring that it's in the right locations, and we can actually then deliver it to our scientists, to our operators, to the folks that need to utilize that data to make the next decision and to really understand the impact of the treatment or the impact of the activity that the patient is engaged in. And while that sounds like, oh, well, it's just data and moving it quickly is not that important, I would argue it's one of the most important things we do, because the faster I can get at the data, and I'm speaking not as much towards the real time aspect, but more when I can paint a wholesome picture about an activity that a patient has engaged in at a point in time, and I can evolve that with additional and enrich it with additional information, I can make better decisions about how this product is performing. I can make sure that it's safer quicker. I can identify issues quicker. I can ensure that protocol deviations, which can be problematic, right? And a protocol deviation, as a simple example, is, somebody at a site's not taking blood pressure. And the sooner I know that, and I can say, whoa, you need to take blood pressure because that's a critical element in the protocol. All of that is critically important. And I think our ability now to do that, like never before, leveraging products like Striim and, our access to tooling, is just incredible. It really is changing how we can allow operators to make decisions, not just better, but with more information so that they can be far better, or far more accurate about what they're observing.
Yeah, thank you. We're always very happy to partner with incredible operators, especially those who are delivering a service that's vital to all of us. With the work you're doing at Parexel, I'd love to drill into that a bit deeper and see, like, at a high level, I'd love to understand the strategic advantages of using platforms like Databricks and Striim together, and how that's sort of helping you create that enterprise source of truth.
It it sort of goes back, or it does go back to integration. And I think being able to leverage, for, specific to your question, Striim and Databricks, that integration and analysis capability at unprecedented speed and scale allow us to streamline the other activities that we need to do related to that data to make sure that it's in the right position when an operator needs access to it. And, we go back 10 months ago, 11 months ago, I had a team of, a couple of folks that spent a lot of time monitoring reports, getting reports back on, what's the status of a particular piece of information, and where does that data need to go? And I've had a problem, and so now I need to rerun it. And how do I do that? And how do I keep it in sync with the rest of the database? Those issues really have disappeared leveraging Striim and Databricks. And it really, therefore, gives us the ability to really look at investing time in some of those AI powered solutions that many of us are talking about, whether we're building them ourselves or we're acquiring them through partners. And in our world, that real time capability at quality, at scale, also allow us to think really in real terms about how we accelerate the overall drug development process. And importantly, that there's such a tight integration between those capabilities that it allows us to continue down this unified sort of data ecosystem road where, just in a couple of years past, we were having to build integrations and monitor those integrations and, internally really manage the data infrastructure that connected together to make sure that data delivered where it needed to deliver at the right time. And so, it's really unbelievable the leaps and bounds that we've made leveraging, again, Striim and Databricks. And it's really driven down our cost and increased our operational efficiency as well. I should probably add, sorry, I didn't think about this. I mentioned early on about, developing resources. The other thing it does, and this is important in our world, and I'll give you a little aside, it is not uncommon for companies like ours, pharma, biotech, CROs, smaller organizations that deal with clinical development projects, and I have some myself, to have hundreds of, I'll just call them databases, right? Hundreds of databases running on platforms, sort of sitting in suspense just because I'm required to.
Tacking on to the balance between modernization of your data infrastructure and keeping the legacy system stable, like through this modernization, how do you balance the people skills, like the actual people building these pipelines, between the modern technologies that you're bringing in and the proven data technologies that have been around for decades?
That's a great question, John, because as you well know, we have an environment, and it's true of our customers, it's true of our competitors, where due to safety, due to regulatory requirements, due to historical record keeping and long-term safety follow through, there are many times when you might have legacy environments that will continue in the environment for up to 10 years in some cases. And so it also, as we think about how we do that modernization and we drive down that incremental path, we also have to think about how do we focus the teams that have been more legacy, right? Getting them exposed to the new tools and technology, while at the same time allowing us to maintain, that legacy infrastructure. And so we also are looking at how do we bring in those new technologies? How do we think about more modern environments like R and Python and the things that we're doing with open source to ensure that we have those new skills developing. And one of the things that we are also doing is we're making sure that we don't lock anybody in a box. We want to make sure that all of our teams, both on the business and on the data and technology front, have access to those tools. So we can continue to keep those legacy environments running and maintain them and ensuring that the data can be captured and reviewed as necessary, but also exposing them to new tools, new patterns, new capabilities that allow them to take advantage of what AI can do, what new automations and hyper automations might be available, and also experiment, right? Be innovative.
Yeah. I working with a lot of CIOs and chief data officers, there's always this balance between modernizing data infrastructure and doing things like AI and real-time analytics, and then keeping those kind of proven production systems that have been, there for decades stable. And, no one wants to shut off a mainframe or a database that's been running for 20 years. I mean, people will raise their hand and say, you just broke some process that's going to take us months to repair. Right. So how do you balance this?
That's a great question. And we are an industry by design. And let's be clear. We sort of jokingly refer to those types of things tongue in cheek, but we maintain those historical reference points because safety is imperative, right? Nonetheless, maintaining that sort of modernized data infrastructure and legacy, it's a journey and it's a battle. And what we've really tried to do, and this really takes partnership with our CFO, with our CEO, with our chief business officer, our heads, what we call our OEDI team, and our business units to recognize, one, we have to maintain modernized systems as much as we can. At the same time, we have to be cognizant that we also can't break the business and go through these multi-dimensional, multi-phase programs of activity just to upgrade a system. And so what we really started to do is look at it more as a modernization journey. And so as we implement new technology, particularly as it interacts with the user or the user interacts with it, one, it's a journey, not an event. So we want to focus more on not incrementalism, but let's do things in a way that are easily digestible. Two, our engineering pattern has to be integration is essential. And so no longer are we allowing, if I can use that word, products and services that do not tightly integrate with our ecosystem. So if you've got a service that, is going to hang the moon and grow revenue, we need to figure out a way to get it integrated. And if we can't, then one, is it an acquisition target? Okay. And two, are there other options that we could build, define, find that could fill that gap? We also are therefore big on governance and compliance. Again, as I mentioned earlier, we're not making that a barrier, but really an enabler, and ensuring that as we work closely with our legal partners, our regulatory, our quality partners, that we understand the changing landscape. So as we think about that journey, the path that we're on to maintain that modernized infrastructure or service, that we're always, maybe like a V1 in lockstep behind where the regulations, where the quality requirements are, because we don't want to be in front of them for sure, but we also don't want to be too far behind that we could get caught out.
Yeah, I mean, if you have the strategy and they have the the pill you need to swallow, for lack of a better phrase, yeah, just wrap it up by saying, hey, I'll help fix your problems in a few months, in a few quarters, right? And
That's right.
that's where the partnership starts. And I think the great thing about CIOs who have that intuitive awareness of what the business needs and can find out like the right ways to sort of phase out the deliverables within your strategy. Like for instance, you're modernizing your data infrastructure. That's not something that happens overnight, and it's really hard to tell people in the business, you just got to wait till I modernize our data infrastructure. Right? No one wants to hear that. I mean, people understand and understand the value of that, but so it's definitely part of the whole balance.
Yes, it is. And I'll tell you the other thing that's really critical on that front, and we've really tried to focus on this the last few years at Parexel. We, i.e. the data and technology organization and our technologists in the business, we have to deliver, meaning one of the things that is sort of the worst thing you could do as a data and technology leader, whether you're the CIO, CTO, et cetera, is these perpetual projects that never seem to complete, or only always getting to 70 or 80% and never getting to the end. Being able to close things in a way that positively impact your user community, that there's a lot of what I like to tell my team, emotional bank account that comes with that. And so the better we can plan with our business what success is, what it looks like, when we expect it, and then deliver that. And by the way, it doesn't always mean you're not going to change dates, or you're not going to run a little hot on budget, or you're going to have to change things. But if you can have that tight collaboration and open, transparent, honest communication with each other, and you start from the position that we're all looking to achieve something really positive for our business, there's not much you can do better than that in order to be successful. And that is for Parexel to be successful, for our business, for our operators, for our tech people, our data people, for our patients, for our customers. And I think that is a critical skill. And in fact, you know, our CEO Peyton is super focused on that. And I think without that leadership and without developing that culture of we're all looking to really achieve positive outcomes for our patient, for our customers and ourselves, you won't be successful. So that is a critical attribute of the work that we do.
So we talked about this a little bit, but really just to drill down on AI, which is reshaping many industries, like where do you see the biggest opportunities? And, we talked about compliance as an enabler, right? How understanding the risk factor of AI, where does that sit for Parexel and in your clients?
That's a great question. And I think what I hear a lot in our business, first off, and you've heard me say patient many times, patients and customers. We are patients first in everything that we do. And, we think patients first. It's quality, respect, empowerment, and accountability. And one of the things that we're really starting to see and think more about with our operators is what are the patient guided approaches that we may begin to see? Think about it. I'm not wearing my Apple Watch today, but you've got Apple Watches. I do have a Lumen device. You have Lumen, you have, Ultra Human Ring or Aura Ring. You have all this patient reported outcomes capability that have existed. And I think what we're starting to see our medical teams and our project teams in the launch community think about is how can we harness that patient data in a way that we can start to develop better patient guided approaches. And that's important because one of the things in clinical development that's difficult is this idea of patient burden. And if you can imagine, looking at a protocol that engages the patient in a number of visits, and as part of their visit, they're going to get, a liver punch biopsy, right? Mm. How many of those do you think they're going to do and keep coming back? Not many, right? Or, they have to have spinal fluid drawn. And I'm using those sort of they're not even outliers, but examples that make people cringe because they're real examples. But also, if we can learn more because of the patient reported capabilities that we have now, could we actually drive protocols because the therapeutic areas are, we're focused in more complex areas, particularly oncology and CNS. Could we learn better how to learn from the patients or learn from the potential patients in that case that guide us to make different decisions about the protocols? Also, I think AI will substantively enhance the term you hear a lot, data-driven decisions. If you think back just 5 or 10 years ago, data-driven decisions were about analytics. Well, we're now beyond analytics. We're now about knowledge. And the thing that the advent of large and small language models and generative AI and inference and, the things that can be harnessed under that umbrella of AI can really change those data-driven decisions from responsive to proactive. And I think that's going to be a massive game changer for all of us. And then there's the obvious operational efficiency. If I can, one of the things that we've deployed is an AI-driven monitoring visit report, for example. If I can give that clinical monitor back a day of travel, it's less expensive for my customer. It's less, cumbersome and tiring for the monitor. The monitor can spend more time doing the work that they need to do as a monitor, not as a, data entry person. And as I like to say, if I can give a monitor back Friday every week, they're also going to remain an employee, right? Because they can now go do things that they've not been able to do. Because I will tell people, you've never done a CRA ride along, you really don't know what travel is, because it's a backet breaker. It's out on Sunday, back on a Thursday night, if you're lucky, sometimes Friday morning, and then you got to catch up on all the paperwork. And so, if we can give people back time, or, said differently, quality of life, we're going to maintain that employee population. We're going to improve the results that we see from them. And that's all good for the patient and better for our customer.
Yeah, these efficiencies in the operations, people underestimate how big of an impact that makes to the end customer. In your case, the patients, right, and the quality of life of the people who are getting services around these events in their life that are that can be traumatic in some ways, right?
Right.
And the and people have family members who go through this, and ultimately you want this all to be streamlined and efficient. You don't want the care providers to not have data and slow things down and make it more of a, just bog it down with manual office processes. So
Absolutely.
how do you imagine, Databricks and Striim helping you achieve the AI vision?
Well, I think by and large, it's the integration that's developed as part of the tooling. To it's our ability now to quickly harness multi sources of data at speeds and at reliability that we struggled with in the past. And I think it's also an at scale discussion. What we're seeing through the use of Striim and Databricks show us that, one, not only can we address inordinate amounts of data, we can also ensure that they're compliant, that they're consistent, that we're efficient, that we're driving the best cost per turn in the CPU as we can. And that's important the more AI grows. And so I think there's really not many examples that I would choose differently, because the combo of Striim and Databricks is just an accelerant to the work that we do. At the end of the day, we're delivering, again, a product that the better we can do with time, reduce time, the better we can drive quality, so greater quality, and at a better price. That's a winning combination. And certainly our architecture, including Striim and Databricks, allow us to do that at one, reasonable rates, and also at very high capacity. And that's a perfect combination with the onslaught of data and results that we have in our business.
We're always happy to partner with you, and we do love how you think about this at at a patient level, and and that's ultimately a core to the business is the experience of the patient, and then the labs that are running these tests, and it's all related, right? Like these are all just little cells that make up the body of a company, and it's great to see how you work and how you think about this. It is really inspiring. And I wanted to ask you, what advice would you give to other CIOs trying to lead modernization and transformation in compliance heavy industries, and also just industries that operate at the type of scale that Parexel's at?
Just in industries like ours, that are heavy on the compliance and regulatory front. So, many industries that you guys deal in, it's interesting because we have to navigate a uniquely complex environment when you're balancing a global capability. And I mean, if you can imagine, you've got different regulatory requirements depending on where we're operating, in one of hundreds of countries around the globe on a daily basis. But I go back to, one, don't make those things a barrier. Make them part of the journey. Make the requirements that you have for quality, compliance, regulation, actually a skill that you hone, and it becomes an enabler. As I mentioned earlier, it's like the training wheels on a bicycle, not a fence to jump over. That's the first thing. And I think coming to terms with that, I think is critically important. Two, what I mentioned earlier, for example, our partnership with our OEDI team, who really acts as a proxy into our business. And we've done that to make sure that we are as tightly coupled inside the business as practical, so that when we're driving towards solutions to address those sparks I mentioned earlier, that we really understand the why. And one of the things that I would stress to folks looking to do what I do is back to that, getting the right people in your organization and thinking about what's the next iteration of those staff. That I often say to those folks, we're not a IT organization inside of Parexel. We call ourselves data and technology as a way to not get stuck in that term. And you may ask, well, why is that? We're a clinical development enabling. We're enabling clinical development. And it just so happens that we deal with the data and technology. And so that business alignment really requires deep understanding. And, we haven't done it post-COVID as much, but one of the things that we used to do quite frequently is what we call ride-alongs, right? And we're going to start that up here probably in the next couple of months. I mentioned COVID because it changed where people could go, right? There wasn't a lot of people spending time face-to-face with one another. But that business alignment is critical. And also, we talked about it earlier, modernization. You've got to build a plan with your legal team, your commercial team, because even contracts need to refer to it, your financial partners, and the overall operational leaders, that we have to build in those changes that are going to allow us to maintain that. I like to use the N-1 modernization, right? We're not always going to be at the latest version, but we cannot afford to be multi versions behind. And then I would also go back to what I said earlier around, you still got to do the hard yards, to quote a really close friend and mentor of mine. You got to do the hard yards. It is about data definitions. It's about data governance. It's about ensuring you have business ownership of the data, and you drive that governance process. Otherwise, you're going to fall afoul of data quality. And as our tools, with the advent of AI and products like Striim and others, you cannot afford for your data to be in the wrong place, or not at where it needs to be at the right time, or the wrong data to be available when lives depend on it.
Absolutely. Jonathan Shough, CIO at Parexel, thank you so much for joining today's episode of What's New in Data. And thank you to the listeners for tuning in. This was super special. A lot of great advice here, and just learnings that a lot of people can take with them. So thanks again, Jonathan, for joining.
No, thank you for having us. And I hope that our discussion impacts somebody in a positive way. And I really appreciate you giving us the opportunity to present today. Thank you very much. I've enjoyed it.